Hi there, everyone, and good afternoon. I'm Will DuPree in the KXAN live studio. Thanks for sticking with us today. We wanted to share some information about the local coronavirus situation. So if you take a look right here, this is the lead story on our website right now over at KXAN.com. The story there, 2 ICU beds left in the Central Texas region, the local health authority announced earlier today. To delve a little bit more into this particular subject, and this is a very important topic at the moment, we have KXAN's digital reporter Grace Reeder with us right now. Grace, thank you for being here and to share this information.
Yeah, thank you for having me.
Tell us a little bit about what Dr. Desmar Walks told local and county leaders.
Well, obviously the big headline this morning, like you just shared, is that in the 11-county region that Austin is within, there are only 2 available ICU beds as of yesterday. We see some delay in those numbers, so we're just learning that this morning. I do want to provide some context to that information, though. That ICU bed capacity that we talk about, that fluctuates pretty regularly. People get transferred out. Unfortunately, people pass away. So those numbers do change regularly based on staffing and other factors. So we did want to provide that context, but it is important to share that information because it tells you just how dire the situation is here. The other thing that Dr. Walks talked about was they can't really transfer patients out of our local hospitals because this situation is happening statewide, nationwide. They are seeing staff shortages and therefore not enough beds for people.
And earlier, the interim director for Austin Public Health mentioned that there is going to be another isolation facility opened back up in Austin.
Yeah, we've reached out for more details about that. What we know so far is that it is not available just yet, but will be providing 50 additional beds. And again, we've reached out to figure out where that facility is and exactly what they're going to be providing. Dr. Walks has said they don't have the staff for any additional facilities, so we assume that that facility will just be for people to isolate and not receive care.
Because of that situation with the intensive care units being very limited in their spacing at the moment, a lot of questions are being asked about holding large events this weekend. Namely, Austin Pride is holding its Pride Parade and other events this weekend, so a lot of people might be thinking about that. What did Dr. Walks address about that particular issue during this briefing?
Yeah, we're following those events very closely. People want to know what's safe for them to do and also what's even going to be available. Dr. Walk said that they are talking to organizers of large events. Of course, we're looking forward to Pride this weekend. She said that they're asking organizers to look at mitigating efforts, and some of that includes timing, so perhaps staggering some of the ways that those events work. But of course, we're still following those details very closely, and we'll have all of that information for you when we get it on KXAN.com.
All right. Well, yeah, we'll definitely keep up with that, too. The big push right now from health experts, both locally and nationally, is to get people vaccinated. What are the doctors saying at this point, and what are some of the questions that people have asked you to pose to them?
Well, I talked to a family this week, a woman who says that her kids in their 40s refuse to get vaccinated. She reached out to us because of our Keep Austin Well town hall, and she asked, how do I talk to them about this? Right now, there's an additional push from health experts to use the Delta variant to your advantage. There's nothing good about the Delta variant, but it does give you extra ground to stand on when talking to your family members about this. I did talk to a member of the Texas Medical Association's COVID-19 task force this week. Here was his answer to that question.
It's really important for everybody that's unvaccinated to realize this. This is the most dangerous time to get COVID in this pandemic. The Delta variant is much more contagious. It may not be much more dangerous to you from a health standpoint, but it spreads a lot easier. In saying that, if you have a family member that doesn't want to get the vaccine or has been hesitant or resistant to get the vaccine, I think it's a time to just have a conversation and tell them why you want to help them, how you're trying to protect them. And it's not about them. It's about your care, your devotion, your dedication, and you just wanting them to be safe as possible.
And Grace, that really came from a question that, again, was posed at that town hall that we hosted just last week with a lot of different doctors and health experts, using maybe this as an incentive to get that vaccine.
Yeah, that's right. I think people are just really wanting their loved ones to sort of hear that message right now, but it's hard. easier said than done, right, with some folks in your family. And so that doctor you just heard from really said, like, listening is key. Connect people that you love with, people that they trust, and really hear their concerns and connect them with those resources. Another push could be also money. So another thing that we talked about this week was how expensive it is to end up in the hospital with a COVID-19 related illness. I talked to one family who their dad was in the hospital with COVID-19 on and off for 9 months. They were looking at a hospital bill from one hospital in particular that was over $250,000. They're still working through how much of that they're going to have to pay and their insurance is going to pay, but it costs a lot of money. We did some digging into exactly how much, according to Price Point, which is a tool that the Texas Hospital Association has put forward. Just being in the hospital with an illness like COVID-19, you could pay roughly $11,000 a day.
This is a folder of all the bills that I have of different, I guess the different doctors that see my dad, that, the services, and it's a lot.
What an unfortunate situation for her too, but I mean that is a big part of this as well, that if someone ends up in the hospital battling COVID-19, perhaps they didn't get vaccinated and have to go through very expensive procedures, it's going to cost you too.
Right. That's exactly the point. It's expensive, and it's scary for your family members too. We've talked to a number of family members this week who have people in the hospital with COVID-19, and they're really worried, especially as cases continue to surge and care therefore takes a hit.
All right. Well, circling back to what was discussed earlier today during the COVID-19 briefing that Dr. Desmar Walks, the local health authority, provided to local leaders, she mentioned some cases that had been identified in children, and this was in her report there. Children who had been admitted to hospitals locally with COVID-19, they tripled in the last couple of months. So it was about 11 in June, that went up to 34 in July. And then in that second point there, the pediatric admissions to hospitals are higher now than they were in the entire last year during the pandemic, 222 as of just this year, and then 139 in all of last year. So we're well above that. And that has got a lot of people thinking, what about school starting again with these particular troubling signs?
Well, of course, the big news last night was that masks will be required in schools here in Austin,
right,
going against governor's orders. And that's the same case in other parts of our state. That conversation is being had, of course, in Dallas and in Houston. They're having those conversations as well. Dallas doing something similar to us here in Austin. But that is something that we have heard a lot from parents are very concerned about sending their kids back into the classroom right now. And our education reporter, Alex, has done a phenomenal job covering what the school districts are doing, how they're going to be informing parents when there are cases in schools, what precautions they're going to be taking, masks on buses. We have all of Alex's reporting. He's done a phenomenal job over at KXAN.com.
In addition to the questions that we've been addressing so far, there have been far more that have come in. What are some of the other ones that you have really dug into in the last few weeks?
Well, a lot of people want to know about behavior, specifically people who are vaccinated and maybe had a breakthrough case. We had a number of people reach out during that town hall and ask, what do we do now? It's important to know that even if you've been vaccinated and have a breakthrough case, you can still transmit COVID-19 when you recover to your family members. Doctors tell me that anyone and everyone at this point should consider themselves, you can be contagious. You can transfer that to your loved ones. So if you have the virus and then are vaccinated, you can still pass it along to your loved ones. We also had a number of people ask about underlying health conditions and whether or not the majority of people vaccinated or not in hospitals have underlying conditions, as we were seeing earlier in the pandemic. Health experts here in Austin, the Austin Public Health tells me that more than 50% of people in hospitals right now do not have any underlying health conditions. The real statistic in hospitals is people who are vaccinated or unvaccinated. The numbers that came out today, more than 80% of people that are in our hospitals right now are unvaccinated, around 4% partially vaccinated, especially with the Delta variant. They say it is just so important to go get your second dose. If you've gotten your first dose, have not gotten your second, you really need to go do that.
I just want you to hit back on that point about the number of unvaccinated people who make up the current hospitalizations.
It's more than 80%. The number, I believe, 69 people in hospitals who are vaccinated. That's out of the more than 690,000 people here in Travis County that have been vaccinated since January 1st, a relatively very small number.
So health experts are saying that the vaccine really does make a difference in helping you stay out of the hospital and not getting seriously sick.
Right, that's the message right now, is that vaccines are what help prevent you from being one of those cases in ICUs, in hospitals, and from dying.
All right, if you are just joining us, KXAN digital reporter Grace Reeder is here in the KXAN live studio talking about some of the latest developments with the COVID-19 situation here locally. Grace, if people are just joining us, they may see the headline at the bottom of the screen there that only 2 intensive care unit beds remain open in the entire Austin metro area. That's about an 11-county area, I believe. Tell everybody again what Dr. Walks, the local health authority, said about that particular issue.
Yeah, so those 2 available beds, that is within an 11-county region that Austin is within. So all of the counties around us use our hospital systems here in Austin. So they have to rely on that capacity as well. But if you're just joining us, I do want to provide the context that when we say there are 2 available ICU beds in our region, those numbers change rapidly because people can be transferred in and out, people can pass away. There are a number of factors. One of the big factors is staffing. So we've heard a lot about staff have been really hit hard by this pandemic, and so if there's not staff available for a bed, it doesn't count as an ICU bed because you won't get the care. So she is saying there is a dire situation in our ICUs right now, and that's where we get that 2 number from.
And just to reiterate for people too, a lot of these cases that we're seeing, this spike that we're experiencing here locally, is driven a lot by that Delta variant.
Yeah, that's right. The Delta variant is more transmissible than the coronavirus that we were seeing a year ago. So what they're saying is that there's going to be more of the virus in essentially your nasal passages. So you're more contagious, and they're still trying to figure out exactly how much more contagious and based on whether you're vaccinated or not, sort of how contagious people are. But the overall theme and what experts have told me is that the Delta variant is just significantly more contagious than what we were seeing last year, and even significantly more contagious than flu and other diseases that we've been sort of comparing COVID to this past year.
All right, well, again, this is Grace Reeder who's joining me. She's been spending the last couple of weeks really diving deep into questions that a lot of you have sent us related to COVID-19, the Delta variant, the vaccine, and so much more. So, Grace, tell people where they can find some of your reporting if they are interested in wanting to learn a little bit more.
Sure. We've done a number of reports over these past couple weeks. Really, the best place to start is our Keep Austin Well Town Hall. We have that link posted for you. The entire town hall video is clipped. It's on KXAN.com. So look for that. Aside from that, we also have a couple articles that have branched out of that with some of the questions that did not get answered in that town hall. You can look for those at KXAN.com as well. And of course, we have our coronavirus tab at KXAN.com, so you can find all of that latest content really easily.
All right. Grace Reeder, thank you for joining me. We appreciate it, and keep up your great reporting. It is a huge resource for everybody. So go and look at her stories right now over on KXAN.com. Grace, thank you again.
Thank you, Will.
All right, everybody. That'll do it for today. We will be back throughout the day with other updates, so please stay with us. Once again, I'm Will DuPree in the KXAN live studio. We'll see you back here another time. Everybody stay safe. Take care.